Hi, my name is Mendez. I'm a ketogenic lifestyle coach and complex trauma recovery coach. I have a very incredible story in regards to how I used metabolic therapies to recover from very serious mental health issues, including bipolar, borderline personality disorder, OCD, and even body dysmorphic disorder. My journey did start at a very young age when I was quite anxious and sad, and I did have a difficult childhood. So over the years, the diagnoses kind of piled on. And then finally in my 30s, I was officially diagnosed with bipolar 2. I did come to a period where I was beyond rock bottom, and that was about 6.5, 7 years ago. My history with medications began actually at 12 years old when I was prescribed my first antidepressant. And at 12, I wasn't too keen really on taking medications, and I don't remember anyone really following up to make sure that I was taking it. I don't remember antidepressants at an early age doing anything for me for the depression and anxiety. At 14, I was hospitalized, and there was a cocktail of medications prescribed at that time too. Again, I do not remember them working, and I actually had a very dangerous side effect while I was in the hospital of tachycardia. My heart rate had just gone up to, I think it was 180, and I was just sitting there. Fast forward to when I was a young mom, so by the time I was 24, I had 4 children, and again, very sick, and knew I needed to do something with all of these diagnoses and the lack of function and all of that. And I would try throughout the years over and over again, see a different psychiatrist, to go to a different facility. I tried over and over again, and I could never get through the side effects. I couldn't get to the other side of that bridge of side effects, right? It's a side effect bridge. It's like you go from desperation and suffering, and you might go through now different kinds of suffering, and to have any chance of finding out if you will have some relief, you've got to get to the other side of it. With 4 children, I could never get to the other side of it, of the adjustment period and the complete and utter exhaustion. And sometimes my irritability was even worse, or I would just be gaining weight, and that would make me more depressed and miserable. So I'm not totally anti, medication. I think there was a time right before in the years before keto that I did finally, my kids were older, and I did finally get on a cocktail of medications that did stabilize me a little bit. But again, not to the point where I could function in society, just to the point where I was less likely to commit suicide, to be frank. In that turmoil, divine intervention, intuition, I said the last thing I could try, because I felt I had tried quite a few of the recommended therapies and recommended approaches that we have available in the standard psychiatric care system. I said, you know what, it's really my last hope. I searched the internet, and I just happened to stumble on maybe 3 sentences that said ketogenic diet might help people with severe mental health issues, including bipolar. And I said, okay, well, that's the diet I'm going to try. And it absolutely changed my life. There's a night and day difference between Mia before keto and Mia after. I was debilitated for 4 decades, honestly. And, I kind of say I'm a 6-year-old adult now, because it's been 6 years on keto, and I feel like I just started my life. I've just been able to participate and function to some decent level 6 years ago. So it's night and day difference, and I would absolutely say it saved my life. I felt the effects of ketosis very, very quickly. Now, I didn't become keto overnight. I did the gradual approach. And the gradual approach involved falling off of keto, once a week, and then it became a week and a half, and then it was 2 weeks, and gradually, I became keto. So it was a very slow, easy process. I was not going to be able to handle the cold turkey kind of approach with the condition that I was in. So once I was producing ketones and got through a little bit of the keto flu, I just became very tired for a week or two. I had a period of bliss. I had never felt, I had never had a day without anxiety in my life. I always had trouble leaving the house, trouble leaving the bed. The bed and the couch felt like a giant magnet most of my life. And the thought of going outside was a project. And we're not talking to go do anything spectacular. Just going to the grocery store was monumental. So I experienced this period, I would say 6 weeks, very quickly. Again, I'm fortunate. This is not the case for everybody. Could take up to 9 months for somebody. But in my case, I would say 6 weeks. I just felt this complete parasympathetic, which is the rest and digest part of our nervous system, kick on. And I couldn't believe it. I said, is this how normal people feel? What stops anybody from taking over the world? Because I'm like, I could do anything with this nervous system. And also my chronic pain, which I don't know if I've mentioned, I had terrible chronic pain and spontaneous injuries in my joint, very painful. My shoulders, my hips, and my knees would spontaneously have these little micro tears in the labrum. That went away. And that went away pretty quick. And the tears started to heal. And I had a rotator cuff injury, and that was healing very quickly. So it happened quite quickly. Did I stay in a blissful state? No, I didn't stay that on cloud nine, but it was incredible to feel that peace and to be able to just go outside and do what I had to do. I've never had an episode of bipolar ever since I started the ketogenic way of eating. And also some additional benefits. My tinnitus disappeared. And I also had abnormal PAPs for decades, and they've normalized ever since. Trauma is a large part of my story. It's a big part of my story. And ketogenic therapy is not going to erase anything that I've gone through or anything that I've suffered. But what it has given me is an opportunity to have a stable nervous system that has the capacity to implement and understand other kinds of therapy. Before when I was battling with bipolar, it's like trying to build a structure in an area that has spontaneous earthquakes. So every time you try to put two pieces of wood together or some scaffolding together, anything together, you never know. It's just going to come all tumbling down because you're having an episode. I look at keto as it was the vessel that brought me to the port of healing. That's how I love to describe it. So I've been delivered to the port of healing where I could do EMDR. I could go through a very intense complex trauma recovery program. It's 5 days a week. It was like a total of 3 hours a day for over 3 months. Very, very intense, not for the faint of heart. I would have never been able to get through trying to unravel all of the trauma and all of the things that I had gone through if I did not have the bipolar under control. Did not have the capacity to go through that kind of healing without having been in remission from bipolar. If someone came to me asking about the ketogenic way of eating, and why it might benefit them, I would really start with a simple explanation of how, although we don't know exactly what causes mental health issues, we know all of the risk factors. And of course, I would probably point them to Dr. Georgia Ede and Shabani Sethi's work, and of course, Dr. Chris Palmer's work. But I would explain to them that there is a connection, between what we eat and how our bodies and brain function. And explain, of course, my own story. They would relate to a lot of the frustration of trying so many other things, medication, talk therapy, not really getting very far with it. So I think sharing my personal story, pointing them in the right direction as far as a little bit of the science, and just explaining some of the risk factors. Like I said, it's oxidative stress and inflammation and partially genetics and our environment, and say that this way of eating targets a lot of that. We're so desperate when we're going through the allopathic mental health care system. The desperation is insane. So it's like, really, what do you have to lose but to try this, alternative way, which should be the standard way. Of course, people in this community believe that, but it's not yet there. But there's nothing to lose by cleaning up your nutrition. The ketogenic journey is very nuanced. And although I have a miraculous story, and there are so many stories that are similar to mine, I just want to caution people, it may not unfold for you the way that it unfolded for me. You may need to have, take more time. There may be different tweaks. You may need to have different supplements and different supports in place. And that's okay too. It doesn't mean that the diet is failing or that you're failing. It's just that the journey is so individualized. And I just urge people to listen to their coach or their dietitian or doctor. Don't make adjustments on your own constantly. I do support intuitive eating and intuitive supplementation, but you've got to work with, a metabolic professional so that they can track how the different variables affect you and your ketones. So just to be patient, if it takes 9 months, stick with it. You're still overall improving your health. So there are other things that are happening that you might not be able to notice. But that's also another reason why it's important to work with somebody, because they may notice the changes before you do.